When I saw the list of Gaylord Anderson Award winners, many of whose names I recognize, of course, I was totally humbled that I would be considered in those ranks. I hope that I've had tremendous impact on improving the patient experience. I worked hand in hand in the design and delivery of the new Dana-Farber Cancer Institute at Harvard, and I've worked hard to improve the patient experience through the engagement of patients and families in the care and delivery process. My greatest impact, I think, is through the students I've taught. I've taught now for 40 years at 8 different universities and done hundreds of speeches. And a student of mine gave me a cross stitch that said, "Teachers create the future." And I think we do.
I've been very, very fortunate and have the opportunity to be with a number of organizations that were interested in work overseas as well as the U.S. I was the head of research and development for the Pathfinder Foundation and came up with the innovation of having a pelvic model, which has saved literally thousands of lives over these years, that one could use with untrained women that would mimic the human pelvis, and they could insert an IUD without puncturing through the human body, which is what they were doing, and we're having so many deaths due to the puncture rather than the intrauterine device.
I'd like to think that I've changed the field of public health in a couple of ways. First, I hope that by the technical assistance that I'm providing and some of the guidelines that I've written, that people are able to provide really evidence-based public health program. I'd also like to hope that with the clinical training that I've provided to public health practitioners as well as clinicians, that people are delivering more compassionate and more evidence-based care to their patients. I'm currently doing a fellowship on public engagement, so I'm learning skills about how to message the public, how to communicate with the public, and my hopes are to increase the national conversation around sexually transmitted diseases and hopefully reduce stigma around that topic. Encourage people to go out and get tested, and also not to feel ashamed to do that, and to take charge of their sexual health and be positive about it.
What I have gained from mentoring is, first of all, a lot of hope. And I've met so many great young people who are already kind of changing public health that I've gotten to know. And I see the importance of having the next generation of public health students become the leaders of the future. That is a real strength of this school. And I've actually known students, one this year told me they came here, one of the big reasons was because of the mentor program.
I think the School of Public Health has taught me about the value of connections, the value of collaboration. And so it's resulted in a career where I get to do a lot of advocacy work. I get to do some clinical work, which I love, and I get to think a lot about systems and how do we really tackle an enormous problem on a national level, on a state level, on a local level, so that we can help people to have more fulfilling lives and we can save lives. I think the 2 things that I'm proudest of, in 2016 I helped pass a bill. It was the first bill that was ever passed on the federal level that contained eating disorders language and has provisions that will help people with eating disorders. I'm really proud of that. I actually wrote some of the words that are in the bill, and that was passed and signed into law by President Obama in 2016. And it's tied to the second one. The second one is that I think that in some small way, hopefully in a bigger way, I'm helping save people's lives.
This award is really humbling, but I think a lot of it has to do with the fact that I had these great mentors when I was at University of Minnesota. I mean, they just gave me the confidence to be able to be up front and to lead, and to be acknowledged for that is just really exciting. It makes me feel like I'm doing something right.
That's really my goal in life, is to make a difference. So getting this award tells me maybe I am.
I really, really treasure that we've had the opportunity, my husband and I, to do our little part in public health. I think it's been a great joy to me to have had the chance at the University of Minnesota to take those first steps.
You can't imagine the breadth of opportunities in public health and what will come your way if you're diligent, earnest, and put your heart and soul into what you do.